Now, I want to start with this evening, ladies and gentlemen. I think the British Medical Association has forgotten one of the key elements of the Hippocratic Oath, to do no harm. News today suggests that the BMA has been hijacked by a militant bunch of glorified political activists, and they've decided to go to war with the government. Why? Well, because we're coming out of a pandemic, so their enemy is weak. But in any war, there are always casualties, and those casualties in this case are going to be you, me, and our loved ones. The latest development is that Dr. Richard Vautray, chair of the British Medical Association's General Practitioners Committee, is stepping down. Well, in the same way that a disgraced pirate would choose to step off the plank before being jabbed in the back by Blackbeard's sword, although in this case, Blackbeard is a medically trained trot who wants to topple the government. Vautray helped broker a deal that unlocked billions of pounds for the NHS, but a condition of that was that the government wanted them to see more patients face to face. There was even talk of a league table of GP practices, naming and shaming those who were refusing to do as many face-to-face appointments as they probably should be. And now they're threatening strike action. So, in short, they want more money and less accountability. But apparently 12 militant members of the BMA have said that the deal struck with the government was a surrender, and they forced their chair out. So essentially, 12 people with radical political views are now in charge of the doctors' trade union, and they want GPs across the country to go on strike. The number of face-to-face appointments currently stands at around 60%, which is about 20% lower than pre-pandemic levels. Clinicians were actually surveyed about how good they felt virtual appointments were, and a whopping 93% of them said they felt they were worse for patients and led to vast amounts of misdiagnoses. So, unequivocally, the current setup is bad for patients' health. I think there's a misconception that there's a campaign against GPs as a whole. Well, I don't think there is, but there's massive patient dissatisfaction. How many people in your family have received excellent care at the NHS recently? Now think about how many people have been badly let down by it. How long have people been waiting for a GP appointment, the result of a scan, a biopsy? It shouldn't be like this. It's not good enough. There are cases of people finding it impossible to go and get a face-to-face appointment with their GP. But when they turn up for their COVID jab, there they are, sat there with a needle at the ready. Funny that, isn't it? Could it be because they're being paid per jab, £12.58 per dose, apparently? One GP gave a very vivid account of exactly how deadly the current situation is. He said, "I feel ashamed calling myself a GP. One patient had a melanoma on the back of her neck. She was told over a screen that it was nothing to worry about and prescribed a steroid cream. Now it's metastasised. A lady in her 80s with lower back pain, prescribed paracetamol over the telephone for 6 months. When she came to see me, her spine was full of cancer. A woman with a cough, whose GP would not see her, said it was just a virus. Like a lot of people self-funding, she's now paid for a CT scan and finds out that actually she has cancer deposits in her ribs and sternum and she probably won't be here by Christmas. Someone turned round and said to her, 'I'm sorry, you're just a casualty of the COVID era.'" When you go outside this evening and watch the fireworks, you'll notice that the temperatures have dropped. It's definitely hurtling towards winter, isn't it? And the inevitable annual NHS backlog that causes. Elderly people all over Britain will simply not be able to afford to heat their homes this winter with rising energy bills, so they'll probably get sick. And here we have a cabal of militant medics who are willing to let people die in a bid to either topple the government or line their own pockets, or both. Strike action is usually always about workers' rights. Well, what about patients' rights? The NHS isn't free. We do all pay for it. We clapped for it every week. Would you clap for it now? If the BMA goes to war with the government, they may well win, but they'll lose the war with the public, the war to win our hearts and minds and our trust.